Jawaharlal Nehru would say the following, I think, in partly response, that there are three conditions under which this formation of human capital, both on health and education, can take place. First, you need a capable state. Second, you need some commitment to equality, which is that highly inegalitarian societies where the social distances between castes and classes are so wide that the short answer is there isn't enough reciprocity. And this is not just true of India. I mean, as income inequality rises, you're seeing that argument happen in the United States. So you need at least some degree of inequality. And the third is you need an enlightened public culture where the joy over, let's say, jumping 30 ranks in the ease of doing business, which is a very important achievement in its own right, is really at least matched in fervor and ardor by the joy we would get if we jumped up in the HDI index, let's say even 5 points. And some would looking at India and say, look, India doesn't have any of those three conditions, right? What we are doing is a sort of band-aid job in the absence of those basic political conditions that make for successful human capital formation, as was the case in East Asia and China. Just wondering, since you've looked at all of these systems in their totality, how might you respond to that pessimism or skepticism about India?
Well, I'm more optimistic than that. I mean, government's always very imperfect, but the primary healthcare system has improved very substantially. We do a lot of our work in Uttar Pradesh and Bihar. When we got going, Bihar had less than 20% vaccine coverage rate. We haven't achieved perfection, but we're up over 75%, and that maps very directly to lives saved and to the health of the survivors being substantially better. And so, government, today India's like 18% of GDP is collected in tax. As the economy grows, of course, you get GDP to grow, so that's more resources. And most countries go from more like the 18% up to more like 30%. And so you get a huge set of resources because you're getting that percentage growing and that GDP growth. And so if government is smart, then the education quality and the health quality can grow fantastically. The role of the private sector, I would disagree with Nehru if he was here on that one thing. But government, his three conditions are absolutely right. And we can't let the fact that those things are so imperfect today make us pessimistic. India has improved dramatically, and you have to start with that as the basis. We all wake up every day, see the smog or look at the statistics, but there are things to build on. Some of the states have gotten serious about malnutrition. The standards on food fortification, now we've finally gotten engaged on that. It's a little too bad that the health is mostly in the headlines where there's a cluster of deaths or something like that. Turning that into a systematic focus on why aren't the jobs filled, why isn't the coverage there? That's always tricky because the news likes this one kind of negative event. And that's partly why people's overall view of the progress is way short of what's actually taking place. So without being complacent about it, you have to say, what has worked so well over the last 5 years? Take NHRM. Thank goodness NHRM was done. If they didn't do that, the health spending would have fallen as a percentage of GDP, which is outrageous. Some of that money actually was very well spent. Lives have been saved through that money at about $1,000 per life saved, even though some of the money was not spent well, and that gives us room for improvement. So I do think India has most of the elements that are of interest. Education, which is how you understand, why isn't it improved more you know, sometimes sometimes that is a little discouraging, where you say, what the heck?
Right.
You know, why did China, Japan, Taiwan, Korea, you know, they made the teaching into a real profession. They made the healthcare into a real profession. Now, the digital miracle will let us track who's not there. It'll let us get feedback. You know, is your teacher good? You know, do they engage you in the subject? Did your, you know, healthcare worker show up when you were pregnant or not? So the quality measures on government education, the idea that we'll be able to see that and demand higher quality, I think that's one of the positive things that will enable some of these